This is Carrie Wachter reporting for Global Medical News Network from the annual meeting of the American College of Sports Medicine. At this year's meeting, the college released new recommendations on exercise for cancer patients and survivors. I was able to speak with lead author Dr. Catherine Schmitz, who presented the guidelines during the meeting. These new guidelines that are coming out stress the idea that, like all other Americans, cancer survivors, whether they're getting treatment or they're off treatment already, need to get moving, that they need to avoid inactivity. Is that really safe for patients, especially those who are going through treatment right now?
Yes, the American College of Sports Medicine convened a roundtable of experts to review the scientific evidence regarding the safety and positive effects of exercise training during and post-treatment because we have a new welcome challenge because of successes for earlier diagnosis of treatment and better quality of treatment, so that more and more people are living for a longer time after diagnosis of treatment. So this whole process happens against the backdrop of the fact that there are already existing guidelines for exercise testing and prescription for Americans from the American College of Sports Medicine as well as from the U.S. Department of Health and Human Services. So against that backdrop, the experts were asked to review the scientific peer-reviewed evidence from clinical trials to see what we know, what the state of the evidence is regarding the safety of exercise during cancer treatment. And there are dozens of studies that allow us to conclude that the current federal-wide guidelines for physical activity for Americans are completely appropriate for individuals who are undergoing cancer treatment. And those guidelines start with two simple words, and that is to avoid inactivity. And they go on to say that people should be building to 150 minutes a week of aerobic activity, twice a week of resistance training, and doing some flexibility activity on most days. So there is a preponderance of evidence to show us that in fact it is safe for people who are in treatment to begin to exercise, to continue to exercise, and to follow the guidelines that the rest of Americans have been given for physical activity. We do understand, and we're not trying to say that somebody who is throwing up several times a day and is, really feeling terrible while they're undergoing radiation treatment or chemotherapy, that person should be getting out for their daily jog or going to play tennis. What we're saying is that what we've found is that it is safe for people to continue to exercise during this time period. And the wording actually in the federal-wide guidelines for physical activity for Americans from the U.S. Department of Health and Human Services includes adaptations and modifications for those with chronic diseases. And the words are very simple, and that is to the extent that you're able.
This is Carrie Wachter reporting for Global Medical News Network.